I'm Christine from Big Life Thin Hair, and today I have one of my dear friends, my dermatologist, and one of my oldest clients, Dr. Lisa May, joining us here today. Dr. Lisa May is a board-certified dermatologist with the American Board of Dermatology. She was also a former professor with UNC School of Medicine and currently is the owner of Biltmore Dermatology. Lisa and I have been talking for a long time about female hair loss because as her patient, it's been a concern of mine. And I had asked her so many different questions, and I've also had the luxury of having her behind the chair. So we have spent so much time discussing my client base, my hair, my genetic history, what I could be doing. And it's all sort of led us to this point together where we want to have a nice open discussion about how you, as a woman or a man that is going through any type of hair loss, can really help yourself identify what you're going through, how to properly prepare for your dermatologist appointment, how to really understand what you're going through. We want to talk about some of the societal issues around this and how it affects her business. And then of course, we want to talk about tips, tricks, things that you can do at home to be creating a really healthy environment for yourself. And of course, the most important thing is how you can have a great life and a big life without suffering about this issue, because we're here to help. So Lisa, one thing that I found really interesting in one of the conversations that we had together was how we shared that some of our hardest consultations and some of our longest consultations are around this issue. I see it in the salon all the time. Usually I take about 15 minutes for a consult, but when I'm talking about hair loss with women, I find that it goes on for about a half an hour, maybe longer, because of the misinformation and also the disbelief. There's a lot of disbelief. A lot of women don't want to accept that this is genetic, and it can be a little unstoppable sometimes. So tell me about your experience and what happens to you in your office.
First, Christine, thank you so much for having me. This is great because I think this is such a huge and important topic that so many people have questions about, and there is, like I said, so much misinformation about hair loss. And to back up a little bit, I think that one of the first things is for people to feel like there is hope. There are lots of things to do, and the most important thing is to have the right diagnosis from the beginning. And that is through those conversations you're having with patients and through the conversations I'm having with patients, figuring out what is the true cause of hair loss. There are chapters and chapters in dermatology textbooks about the different types of hair loss. There isn't just one type. They all fall under the category of alopecia, which basically just means hair loss. So it's very important to establish a diagnosis and to come in, see a dermatologist, and have the proper diagnosis from the beginning so that one can move forward. Many types of hair loss are treatable and oftentimes resolve on their own. But knowing that from the beginning, I think, is very important.
We've joked around about both of our grandmothers, you know, and the grandmothers of the 80s wearing wigs. And I think that when I grew up, I just kind of thought, oh, old ladies wore wigs. That's just what happened. You get older and you wear a wig.
Yeah.
Now that I'm entering my later life, I'm realizing that I could be that old lady with a wig on. And I think that so many of our clients, they, you know, back to this disbelief, they don't want to believe that they're just dealing with a real genetic hair loss issue. So there's constant questions about, like, well, could this be my thyroid? You know, a goose chase of dealing with, like, maybe it's my hormones, maybe it's my thyroid issue. I was very stressed out at this one place in my life, or this is what's been going on. So when a client comes in to see you, how can they really prepare for a really thorough appointment so they can get the best out of their time with you? And how can you help them understand, in particular, when this issue really is just a genetic issue that's going to happen to them no matter what?
Yeah. So first off, hair loss takes more time than just about any other diagnosis to take a thorough history. It's detective work. So when someone comes in, be prepared that that should be the only thing you're addressing in that visit. So oftentimes I'll have someone come in for a routine skin check and the last thing they'll say is, oh, by the way, I'm losing my hair. I can't address their hair at that time and give it the attention it needs because it does take a lot of time. So the big things, when someone comes in that I want to know, I'm going to do a questionnaire that asks a thorough history. When did it start? My first question is usually, when was the last time you noticed a normal head of hair? That's going to give me a lot of information. Was that 6 weeks ago? Was that 10 years ago? So thinking back, really thinking back, when was the last time you had a normal head of hair? Now, most people have to lose about 50% of their hair for others, for their family members to recognize that they have thinning hair. So it's not so much what other people think, it's what you recognize. So knowing that, having all of your medications, everything that you put in your body from vitamins, supplements, herbs, every pill, and not only what you're taking, and it's great to bring it all with you, but when did you start all of those? So I am always going to ask, what medicines are you on? When did you start them? When was the last time you changed your dose? The third thing I'm going to ask is a very thorough history about stress. So emotional stress. Has someone in your family recently passed away? Are you going through a divorce? Have you had issues with a child? I'm also going to ask about physical stress. So physical stress can be a recent illness, a hospitalization, surgery, or a change in exercise. So someone who decided to run a marathon and they are all of a sudden running 10 miles a day and a marathon a week, that's a huge physical stress. So asking all the questions about stress. And then I'm going to actually get into someone's diet. So diet is really important. So knowing your diet history, and have you had weight loss? Have you had rapid weight loss? Have you gone on a completely restrictive diet or a big change? So you've gone from eating everything to a paleo diet that's very restrictive in what you can eat. I want to know all of those things when you come in. And then any lab work. So if you've already gone to your primary care doctor and have had some blood work, bring that with you because that's very important too. And that's where I start.